This is Physician Spotlight, where we highlight top physician specialists and their technologies in the Mid-Michigan area. If you or someone you know is struggling with arthritis and pain in your knees and hips, today you'll want to take note because we're going to be meeting with Dr. Srivastava to talk to us about arthritis.
Thank you.
So what is arthritis?
I have a model here to explain what it means. That's obviously a glass model. Your bone doesn't look like this. But look at the top of the head of the femoral head. Right here you got red area that represents the loss of cartilage, and that white spot is the normal cartilage. So eventually, in worst case scenario, this white area is totally lost, and what you have is exposed bone, as in red. Now you have bone rubbing on bone, and there's no smooth gliding of bone on each other. Rather, there is a grinding motion, and that causes pain and stiffness.
Okay, and so how do you know when you have arthritis?
So the primary symptom is pain. You have pain in the joint, which is arthritic. So for example, if it's knee, if you're watching movie for a while and when you start up, that first couple of steps or beginning of that walking is tough.
Okay, now what goes on with joint replacement surgery?
If that's the arthritic part, which is the ball of the femur, and this is your part of the pelvis I have, and the similar changes you will have in your acetabulum, which is part of the cup in your pelvis. So what we do is we go in and we cut that arthritic bone, we take it out, okay? And now you replace that with a metallic stem which goes in your femur, and this corresponds to top of your thigh bone, okay? Now you have a metal ball which goes on top of that stem, which is in your femur, and similar changes, similar surgery is performed on the pelvis side, where we ream and we make tight fit space in here. We put the metallic cup and the polyethylene liner in there. So now after everything is done, you have a metal on plastic. You don't have bone on bone rubbing anymore, and that's how the motion is, and it's not painful.
Now, if someone that has gone through this procedure, what is the recovery time for them?
Fortunately, we have good medications to get you through that time. Okay. By the time it's 2 weeks, when we usually take the stitches out, you begin to realize that, well, I made a good decision, and I would say a month would be a good recovery time for you to be really ambulatory.
So was someone too old to have knee replacement surgery?
Age by itself is not a criteria. It's your overall health and activity is what will decide whether you qualify for surgery or not.
Now, what can be done?
Let's say you are young, in your 40s and 50s, and you have early arthritis. Basically, lifestyle modification is the key. If you are overweight or obese, then first thing is to lose weight. There is biomechanical advantages of losing weight. A pound of upper body weight is about anywhere between 3 to 5 pounds at knees and hips. When you pass the stage when simple pain pill and lifestyle modification is not helping, then you got to ask for some help from your physician. And then you get a referral to orthopedic surgeon and get evaluated.
For more information on Dr. Srivastava and Family Orthopedic Associates, visit physicianspotlight.com.